Heart disease remains the leading cause of death among women worldwide, yet its symptoms in women are often misunderstood, misdiagnosed, or dismissed entirely. Unlike men, who may experience a classic chest pain during a heart attack, women's symptoms can appear subtler and more varied, making recognition more difficult. This can have tragic consequences, as many women delay seeking help until it's too late. This guide will address the 10 warning signs of chest pain that all women should take seriously. Understanding and acknowledging these signs could save lives by empowering women to recognize when their heart is in danger. Never ignore these warning signs. 1. Persistent chest pressure or tightness. One of the most critical symptoms to watch for is persistent pressure or tightness in the chest. This isn't the sharp, intense pain that some expect. Instead, it often feels like an unrelenting weight pressing on the chest, making it hard to take a deep breath. Women may experience it as a squeezing or constricting sensation rather than outright pain, which can lead them to dismiss it as indigestion or stress. Yet, this symptom is an urgent call to action. Persistent chest tightness can indicate angina or an impending heart attack, and waiting to see if it goes away can prove fatal. 2. Pain radiating to the back, jaw, or arms. Pain radiating from the chest to the back, jaw, or arms is a significant warning sign. For women, this pain may not feel like the intense, direct pain of a heart attack, but rather a dull, persistent ache or even a burning sensation. It's a misconception that heart attack pain is limited to the left arm alone. In women, pain can spread to both arms, the neck, or the jaw, making it easy to mistake for musculoskeletal issues. This kind of radiating pain is a red flag, especially when it occurs with other symptoms on this list. 3. Shortness of breath or difficulty breathing. Shortness of breath is a symptom that should never be taken lightly. If it comes on suddenly or intensifies with minimal physical exertion, this symptom could be indicative of a serious problem. Women experiencing a heart attack or heart disease may find themselves gasping for air or struggling to catch their breath, even while resting. This difficulty breathing isn't just uncomfortable. It's a direct signal that the heart is under duress and unable to circulate blood effectively. Pairing this symptom with any sort of chest discomfort warrants immediate medical attention. 4. Nausea, vomiting, or indigestion-like discomfort. It's easy to mistake nausea, stomach pain, or a feeling similar to indigestion as signs of a simple digestive issue. However, in women, nausea and vomiting can be crucial indicators of heart distress, especially when these symptoms appear suddenly or don't subside with typical remedies. Many women may attempt to treat nausea or an upset stomach on their own, but if these symptoms accompany any unusual chest sensations or general discomfort, it's critical to seek help immediately, as they could signal a heart attack. 5. Cold sweats or excessive sweating. Women suffering from heart issues may experience cold sweats, a symptom often attributed to stress or menopause, but in reality, it can signal heart distress. Sweating can occur without physical exertion, catching women off guard, particularly if they're otherwise at rest. Heart attacks can trigger excessive sweating as the body responds to the stress on the heart, attempting to cool down. Any unusual sweating, especially when combined with other symptoms, should be treated as a medical emergency. 6. Dizziness or lightheadedness. Feeling faint or lightheaded is another frequently overlooked symptom of heart problems in women. Dizziness may arise from an irregular heartbeat or insufficient blood flow to the brain, both of which are serious and can precede a cardiac event. Dismissing dizziness as dehydration, fatigue, or low blood sugar may delay essential intervention. If dizziness comes on suddenly or is paired with chest discomfort, it is a life-saving decision to consult a medical professional. 7. Severe fatigue and weakness. Extreme, unexplained fatigue is a red flag for heart disease in women. Women experiencing a heart attack may feel an overwhelming sense of tiredness, where even small tasks like walking or standing become exhausting. Fatigue is often brushed off as a side effect of busy lives, but when it's unrelenting, unusual, and leaves you feeling unusually weak, it should not be ignored. Severe fatigue can signal that the heart is struggling to meet the body's demands, placing you at high risk of a serious heart condition. 8. Rapid or irregular heartbeat. A rapid or irregular heartbeat that strikes suddenly is a cause for concern, especially if it occurs without a clear reason, like physical exertion or caffeine intake. Known medically as arrhythmia, a rapid or pounding heart can cause dizziness, shortness of breath, and chest discomfort. In some cases, arrhythmia can indicate an underlying heart condition that increases the risk of heart failure or heart attack. Women are encouraged to track and report any such irregularities to a healthcare provider, as arrhythmias can be effectively managed if detected early. 9. Upper abdominal discomfort or pressure. Upper abdominal discomfort, often felt as a squeezing or pressure sensation just below the chest, is a symptom of heart issues that many women overlook. Often mistaken for indigestion or acid reflux, this sensation may appear after eating or without any obvious cause and is exacerbated by physical activity. For women, this upper stomach pressure is not a trivial complaint. Heart attack symptoms in women often mimic digestive disorders, so if this discomfort is unfamiliar or accompanied by other symptoms, it demands immediate attention. 10. Swelling in the legs, ankles, or feet. Swelling in the lower extremities, known as edema, is another subtle indicator that the heart is not functioning properly. When the heart is struggling to pump blood efficiently, fluid can accumulate in the legs, ankles, and feet. While swelling can be linked to other health issues, persistent or worsening edema accompanied by chest pain or difficulty breathing may signal a serious cardiovascular problem. Women often encounter a unique array of symptoms when it comes to heart health, which are too often disregarded. Awareness and vigilance can make the difference between a timely intervention and a life-threatening situation. Never hesitate to consult a healthcare provider when you experience any of these symptoms. Remember, it is better to err on the side of caution. Seeking medical attention could save your life. Taking symptoms seriously, recognizing their potential significance, and acting promptly is crucial. Women's lives are worth safeguarding. Take every warning sign to heart.